We found that a lot of our graduates end up going into some kind of rural setting and practicing, and they flourish. We kind of want to build upon that and train them more specifically to the rural setting. Parallels in education, all the educational aspects are the same. They spend about half their time, a little over half their time in the rural community working with at least 2 general surgeons. And when they're down here at the tertiary center at Marshall, they're commingling with the general surgery residents in the traditional program and doing the same exact cases, same exact calls, same exact educational opportunities.
I can tell you that the amount of supervised independence they get here definitely second to none. There is a number of patients with very interesting pathologies and diseases that you don't necessarily get to see in most urban populations. And so they get to see a wide range of diseases in an area that allows them to use their critical thinking as well as their surgical skills, so that when they go out and practice, it becomes almost something that they've seen at least once or twice, even in the setting of complex cases. But definitely plenty of the common bread and butter general surgery cases that we see, so that they feel comfortable in what they're doing.
Residents can expect to get a broad-based education in all aspects of general surgery, the same requirements as a traditional general surgery program, in addition to other small nuances in the rural community that may not be applicable to an urban setting.
Logan itself is a small town, a very tight-knit community. People know people. People know their doctors by first name. People feel comfortable with you. They feel like they know you. You go to ball games with them. Your kids cheer and play football together. So that sometimes makes it a little nerve-wracking too when one of those people you know very well gets sick. So it's kind of special in that way.
We want people to train in a small town, to want to stay in a small town, to become a member of the community, to have their kids play sports in the community, to have them support the shops that are local. I mean, you're more than a surgeon in these things. You're somebody that the people in the community look up to. If you want to succeed, we want you to become a doctor that will reside in a town of 5,000 to 10,000 and has a hospital that is small. You have got to have a desire to live in these communities, to be a member of the community, to work alongside with other people that have different ideas in medicine. And you've got to have the reason to stay there. You like to enjoy the outdoors, you like to enjoy the slower pace of life.
Taking care of whole families. And we'll take a grandma, gallbladder out, take care of her daughter's breast cancer and then her kid's appendix. So that's kind of cool.
To keep the rural hospital going is important for the population that's there. It's important for the people that come for medical care. It's important for the people that live there, so they're educated in medicine, so that their family members can become physicians. If you don't get exposed to it, you won't become it.
I've been here 20 years, and for 20 years I've been saying, oh, I wish they'd send me residents to see what I do.
I'm so grateful to be here. Not only in a surgical residency program, but in this program. Just incredibly grateful to have matched here. Beautiful broad scope surgery is what I hope to get out of my residency, and this program is the first in the country advertising something like that. My partner and I have grown to love the small town living and community, and just church is full on Sunday and the people are good, and we are so happy in this part of the country.